Have you ever felt nervous and then experienced these butterflies in your stomach, or perhaps you felt stressed and then you felt nauseous after, or you had to run to the washroom? That's a sensation a lot of us are familiar with, and perhaps before doing something like what I'm doing, recording this for you, it's common to experience stress, but often we're not connected with our body enough to know how it might be presenting within us. Today we're going to dive into the stress and gut axis, and we're going to really get into the research and how stress can really kind of mobilize in our gut. For those of you who are joining in, hi there and welcome. I am Aisha, and I'm so glad you found your way to my channel. If you're here, chances are you're looking to learn more about managing stress. I'm a naturopathic doctor practicing in Toronto, and like many of you, I faced my own health challenges and have experienced firsthand how stress can affect your well-being. So let's get into it. Hi guys, I'm popping in here really quickly because when I watched this video recording, I realized there's one important element that I would like to bring in because it's important that you understand the concept of stress. A lot of us think of stress as this abstract piece of, stress is just up here, which is true. It's a little bit of thoughts and beliefs that we have. However, on a physiological, so how it affects our body is it actually, when you're under the state of fight or flight or stress, your body then commands its systems to make the stress hormone and many other chemicals. So there are the catecholamines, norepinephrine, epinephrine, cortisol being the stress hormone. These hormones and chemicals then can have an effect on the body. So I think this is important because when I was going through stress and I had a lot of symptoms, gut symptoms, pain symptoms, it didn't really make sense to me when the doctor said, oh, it's because of stress. I really had wished that someone had explained to me how it actually kind of manifested in the body more from a chemical way, and I find that this was really empowering. I'm going to drop this over here and hopefully the next part of this video makes a lot of sense. Did you know there are more nerves communicating from the gut to the brain than from the brain to the gut? In fact, the gut has its own nervous system called the enteric nervous system, and it's often referred to as the second brain. It contains about 500 million neurons, which is more than your spinal cord. This means that your gut is constantly sending and feeding information to your brain about digestion, immune responses, and even emotions. So the digestive system cannot function properly with too much stress or stimulation around it. So the stress response of fight or flight inhibits the digestive system while the relaxation response activates it. That is why the relaxation response is called rest and digest. So often a lot of us don't understand what stress is. So I'd like to bring in the definition that the World Health Organization put out at one point. Stress is a state of worry or mental tension caused by a difficult situation. So stress is a natural response to address the challenges and the threats in our life. It's not always bad for all of us. Everyone expresses stress to some degree, but as we all know, the way we respond and internalize stress makes a big difference on our overall well-being. Now let's take a deep dive into how stress affects the digestive system. So number one is stress can influence the speed at which contents move through the intestines, known as the intestinal transit time. So it can either increase gut motility or gut movement and gastrointestinal secretions and cause diarrhea, so it can really speed things up, or it can do the reverse where it can reduce and delay that transit time and delay emptying, causing constipation. This is where some people experience stress might experience diarrhea, and I have experienced this when I was training in naturopathic medical school. The stress was astronomical. I was having watery diarrhea 5 times a day. And then on reverse, I was also experiencing constipation at times. And this is something that I often find where folks might come in with just chronic constipation or just chronic diarrhea or a mix of it. So under stress, an individual can experience what we would cap it as altered bowel movements. So their movements have changed than what their normal are. There are people who eat adequate amounts of fiber and they're still constipated. And this can be because their colons aren't moving at the speed that they need and they have a slow transit time. Then there are those who have diarrhea 5 to 6 times a day, no matter what they're eating. Another thing that stress can do is it can alter visceral perception, which means the gut becomes more sensitive to pain, especially abdominal pain. Let's take a look at this article that reviews the evidence on how stress influences, gastrointestinal function in terms of the transit time, motility, and pain sensitivity. So in this article, they reviewed a lot of studies and they compounded the research, and they found that in both healthy humans and animals, stress induced the slow gastric emptying, which we'll talk about in a second, but also reduced the transit time or increased the acceleration, and it did alter visceral hypersensitivity. So we are seeing that it does cause this change in sensation, and often found in folks with IBS. Another thing stress can do is it can impair the intestinal barrier and make it leaky. So you might have heard of this term called the leaky gut. And it really comes from this: each cell of the gut lining is kind of velcroed together. So they're kept in place with these tight junctions, and there are many other things, but let's break the science down. So imagine your gut lining as a brick wall. So you've got the bricks, and then you've got the cement or mortar in between the bricks, and they're sticking together and they're holding the bricks together. The tight junctions are what keep your cells together, and their job is to control what gets absorbed into your bloodstream, and they also allow nutrients from food to pass through while keeping harmful things like toxins and bacteria out. Now, eating the wrong kind of foods and stress and certain illnesses as well can weaken these tight junctions, which would mean they become leaky and things that shouldn't get in start to get in. Let's take a look at the research to see what it suggests. Okay, so in this image here from this research article, we can see they're actually showing how stress affects from a chemical standpoint, and we'll talk about that. But if we get down to the gut barrier level, so this is what your gut should look like. It's kind of like bricks kind of all together. And then they have these tight junctions in between that can become permeable or semi-permeable. And this is what stress can do. It can really cause this to allow things that come in that shouldn't, and that has a consequential effect. Okay, so just to recap things really quickly, we learned that stress can alter motility, and it can really change the speed at which things move through your intestine. It can also change the intestinal barrier, so how tightly things are controlled. And now we're looking at how stress can alter the signal to digestive organs or the other organs that help you with your digestion and the production of digestive juices. So there are actually three phases to digestion: cephalic, gastric, and intestinal. The first phase is controlled by the nervous system responding to an external stimuli, such as senses and sight, so the smell of food, looking at the food visually. And based on this information, the nervous system prepares the body to receive the food. It has a whole process that needs to happen. Now, if you start thinking about chocolate or a fried burger and you start salivating, that's you activating this first phase. In the next phase, once food arrives to the stomach, it actually stretches the stomach, and that's where it receives further command. Oh, we received food. And then digestive juices are released, such as hydrochloric acid. Yes, we do make that in our gut, and other enzymes that help you to break down your food further. The last phase is when that partially digested food now starts to move from your stomach to the small intestine. This is where most nutrient absorption occurs. So further digestive juices are released, and some are received from external organs. So for example, you receive bile from your gallbladder, you receive pancreatic enzymes from the pancreas. So together, food is broken down into nutrients and then absorbed. The intestine then signals to the stomach to slow down the acid production and reduce motility to ensure digestion occurs at a very controlled pace. This phase ensures that food is properly digested and absorbed before it moves on into the large intestine, where water and minerals are absorbed and the waste is then prepared for elimination. When under stress, our body prioritizes other tasks associated with the fight or flight response, and it shifts focus away from signaling away to all these digestive organs, as its function is less crucial for survival in the moment. So each digestive phase requires time to function properly. This is where often we find if we eat in a stress state or we eat too quickly, we may develop some digestive symptoms such as bloating, heartburn, or indigestion. You cannot speed through this process. The fourth way that stress can affect our gut is it shifts our bacterial population to unfriendly bacteria. There's a growing amount of research linking stress to the shift in bacteria population, and research studies have began to link the shift in your gut's microbiome or the bacteria population to stress. We're seeing that, and as a result of that, we're seeing that there's more of that leaky gut or gut permeability, gut inflammation as a result of that bacteria shifting as well. So let's review the research. It's actually pretty interesting. During a 4-day military training exercise in the Arctic winter, soldiers were placed in extreme physical demands. They didn't have enough food, they were in freezing temperatures, had a little bit of sleep. Research found that 50% of the gut bacteria actually changed during this 4-day period of time, showing how stress, exhaustion, and diet can quickly impact gut health. Number 5, stress-induced gastritis. So gastritis means inflamed gut. So stress can weaken the protective mucus layer that lines the stomach, which normally shields the stomach from its own acid. So we know that your stomach makes its own acid to help digest food and to protect the skin, so to speak, of the stomach. You actually have a mucus layer that lines it, and stress can really weaken that mucus layer. So when this mucus layer is compromised, stomach acid can damage that stomach lining and cause inflammation and gastritis. In the previous coded research that we took a look at, the 4-day military training exercise, what was also noted was significant gut inflammation known as gastritis. Now, this next way in how stress affects the gut is actually pretty significant. The research on this has shaped and changed the way psychology is now being viewed. So things were being looked at more from a chemical imbalance standpoint. Now we're looking at it more from a gut perspective. So we are now looking into research where we find that stress affects serotonin production. 90% of your serotonin is actually made in your gut, and there are a few proposed mechanisms as to how this happens. One is that the shift that happens towards unfriendly bacteria in the gut disrupts serotonin production. And then high levels of stress, when you are under stress, there's a lot of cortisol, the stress hormone that's being made, that influences the serotonin receptor site in the gut, and this impacts serotonin production. A recent study published in PubMed titled "Young Adults with Major Depression Show Altered Microbiome" highlights how stress alters the microbiome, which might contribute to these serotonin imbalances. So the study directly was looking at adults with existing depression and what their microbiome or bacteria profile looked like. Now, I guess the father of medicine was onto something when he said all diseases begin in the gut. There has been a major shift in the psychiatric world in the last few years towards focusing on the health of your gut for improved mental well-being, and that's something that I'm passionate about as well. Now, just drawing examples from my practice, I've seen patients develop acid reflux from not sleeping enough and working long hours. This isn't to say that that directly correlates, but definitely plays a factor in their gut health. Another patient, she came in her 20s with nausea and chronic gastritis due to life stressors that she was experiencing, and at times she would throw up after her meals and even with just water. Her doctors ruled out any infections or medical conditions, and the only diagnosis given was gastritis, which is inflammation of the gut. So formulating a very individualized plan for her meant understanding her unique life stresses, how she could regulate herself and better cope with them, and getting her the help that she needs. Another patient of mine was an ER nurse and had severe diarrhea type IBS. She wouldn't be able to make it to the washroom at times, and in our session we began by first educating and empowering her, and then creating a plan for stress management. Please know that health is always many different moving parts. It's not just one thing can cause. It can have many causative factors, and I'm not making any medical claims over here. I'm just looking to educate people, and these are conversations you should be having with your existing healthcare provider. If you'd like to know how your stress index is, you can take the quiz that I've listed below in the description. But for now, let's move on to discussing the research on lifestyle choices that can help with gut function. Now, mindful eating, or being mindful when you're eating, can really help with normalizing transit time or the movement of the food through your intestinal tract. It can help with reducing inflammation and gut permeability, so the leaky gut we talked about. It can also help improve serotonin production, and I love this research article because it has provides the evidence behind how mindful eating can really shift your body away from that state where it can now focus on the state of optimal digestion. So for example, in this controlled clinical trial, IBS sufferers responded favorably to mindful-based programs that utilize practices such as diaphragmatic breathing, body scan, and meditation, and they saw a reduction in pain and bloating. Regular physical activity has also been shown to improve your digestive symptoms. It helps move food through at the time that it needs to. We're going to get into the tips listed on the Canadian Society of International Research on their ways as to how they suggest regulating stress. Okay, so here are their tips to reduce anxiety or worry and de-stress. One is to become a better breather. So we saw the supporting evidence on, deep breathing, using your diaphragmatic breathing method, where this can help with reducing stress and overwhelm. Watch your self-talk. I really think this one's important. So this is where a lot of our anxiety, as they state, is self-induced, meaning that we get ahead of ourselves and we wind up our thoughts. So this is quite important. Monitoring your negative thoughts, just in line with the self-talk. So looking at what thoughts you're having, and it helps to, of course, have a therapist work with you. Get physical. So yeah, exercise has been known to reduce stress. It's a way of, regulating your body. It's a way of getting the stress out. Become a better time manager. So often a lot of us are feeling overwhelmed, but we need systems to help us better manage our time or reduce the overwhelm. This is a pretty big one. Learn to say no. So understanding where you can set boundaries and, politely yet firmly, as they say, turn down additional responsibilities when you are at your capacity. Take time out for yourself. This is something we all struggle with. So really understanding that we are humans, we need a little bit of play along with work, and so allowing yourself that time. Have a good belly laugh. So laughter has actually been studied to be a good stress reliever. And then choose your foods carefully, of course, knowing what foods are going to help your health or not. So I hope you find this education and empowerment powerful for you to understand how stress can really cause these debilitating symptoms sometimes in our gut, and I am personally not a stranger to any of these symptoms. I have had full-blown IBS, and I've experienced a variety of symptoms from painful abdominal pain, almost cramps where I had to be bent over, extreme diarrhea, constipation as well, severe bloating, and it really took me to really understand and learn more about my body and understand how stress actually impacts it. Often we're told we're stressed, but we don't really know how it internalizes, and for me what was powerful is to learn this, and that's why I chose naturopathic medicine, is I actually wanted to learn it for myself and understand the details, and it just blew my mind. I mean, I've just gone over about 5 to 6 ways where stress can really just impair the gut, but it's doing things to other systems, and what I'm going to do is present this in layman terms and bite-sized information, and in the next video we're going to talk about stress and hormones. If you found this video helpful, please like and subscribe to stay updated with more helpful education on stress and the effects on our body. And please note that the information shared here is only for educational purposes and it does not constitute as medical advice. Please always consult a healthcare professional for personalized guidance.